Hi, I'm Katie Hubble. I'm the nurse here at Good Shepherd's Cardiac Rehab. In today's class, we're going to talk about a heart attack and congestive heart failure. So we're going to touch base on two different topics today. Heart attack and congestive heart failure. Heart attack is also known as a myocardial infarction, or MI for short, and it results when plaque buildup or blood clot from ruptured plaque completely obstructs a coronary artery that supplies blood to the heart muscle. When that happens, the heart begins to die. So in this diagram here, you'll see this is showing your left descending coronary artery, and there's a blockage right here. They're expanding this to show you this plaque buildup. The yellow plaque buildup here has completely obstructed the blood flow. So anything below this blocked area, that heart muscle is beginning to die because it's not receiving blood. It's not receiving the oxygen and the nutrients that it needs. Once that heart muscle dies, that is permanent damage. Cardiac muscle does not regenerate like skeletal body muscles. So you want to get that open as quickly as possible. That's why heart attacks are so important time-wise. You want to seek medical help immediately. You want to get that blockage open to try to get that blood flow to the heart muscle. So reopening that blocked coronary artery, the quicker you do it, is going to reduce the amount of damage to the heart. It's going to improve your prognosis, okay? The longer you put off getting help, the more heart muscle is going to die. So the sooner you get help, the sooner you can open up that coronary artery, the more heart muscle you will save. Once that heart muscle is damaged and gone, it no longer will function. That's a permanent damage, and you'll have less of your heart muscle that will work for the remaining part of your life. So if you have nitroglycerin ordered, you definitely want to take nitroglycerin. That's the medication that you put under your tongue. You can take 1 tablet every 5 minutes, up to 3. Just be aware, this is given under the tongue because it absorbs into your bloodstream much faster that way. And it opens up that coronary artery. It causes it to dilate so that blood flow can get around that plaque, okay? That's how you're going to save your heart muscle. Now, one of the side effects is that it does give you a headache, and it also drops your blood pressure. So if you have low blood pressure, be aware of that as well. But it's more important to save that heart muscle. For a heart attack or myocardial infarction, there's many different symptoms. It's just not angina or chest pain, okay? That is a very common symptom. Some people will have chest pressure, they'll have chest pain, which is known as angina, but other people do not experience that at all. Other people might just have back pain or shoulder pain. They might have pain in their neck, in their jaw. They may have numbness, tingling in their jaw. They might have pain running down their arm, or maybe both arms, possibly both arms as well. You can have nausea, heartburn, and indigestion. Now, this is a common one that people put off seeking help because they believe they have heartburn and they don't think it's a heart attack. But it is a very common sign of a heart attack, so you need to be aware of that. It's very common for women to have this type of a symptom as well. Weakness, shortness of breath, rapid, irregular heartbeats are also common signs. You might just break out in a cold sweat. You know, these are all things you need to be aware of, that this could be your heart sending you a signal saying, hey, I'm not receiving the blood flow I need from the coronary arteries. Something's blocked, I need help. So we got to get that open as soon as possible. Call 911, don't try to drive yourself to the hospital. As soon as the ambulance gets there, they can start medical help right away. So it's better to call 911 than to try to drive yourself in, especially if you're having a heart attack. And if you were to have a poor prognosis and your heart stop while you're driving, that would not be good. Diagnosing coronary artery disease, we've touched base in previous classes on this one, but just to remind you, of course, history and physical yearly, especially if you have a history of heart problems. The doctor might pick up on some symptoms that you're not aware of that could be showing you that that plaque buildup is getting severe to where you might need intervention. They're going to do some diagnostic tests. They're going to look at the EKG or ECG. It's just an electrocardiogram. They're going to do Holter monitoring is another way they can do an ECG or EKG. It's just done at home. So when they do it in the hospital, they have those 12 sticky pads all over your body, and they're looking at your heart rhythm, at the electrical current that's contracting your heart muscle, that's making your heart muscle squeeze and pump blood. Is that rhythm nice, normal pace? Is it a normal sinus rhythm that's nice and normal, pacing nicely? That EKG in the hospital looks at a 6-second strip. So it's a very short period of time, but it can show them a lot of information. It can show a heart attack, not always. It depends on what type of a heart attack you're having. But it also will show if you're having irregular rhythms or if you're having premature beats in your atrium or your ventricle chambers. When they do the Holter monitoring at home, this can be ordered from 24 hours up to 3 months. And this is looking at a long stretch of time. This whole time they're recording to see, are you going in and out of your regular heart rhythm? Are you in a normal sinus rhythm changing into, say, AFib and then back to sinus rhythm? You know, what's going on? So this gives them a lot more information because they're watching your heart over a longer period of time, not just 6 seconds. Now, if you go to the ER with chest pain or other symptoms, they're going to draw blood. They're going to look at your blood because when your heart muscle starts to die, it releases a blood enzyme. So if you're having a heart attack and heart muscle is beginning to become damaged, it's going to release an enzyme called troponin into your bloodstream, and they're going to monitor that. They're going to see, they're going to draw second blood shortly after, and they're going to see, is that number increasing? Is the enzymes in your blood increasing? Is it getting worse? That's a sure sign that you are having a heart attack. Now, some people might go in with symptoms, yet their blood enzyme tests be normal. So I always want people to remember, just because you went to the ER with symptoms and they told you you're not having a heart attack doesn't mean you don't have blockage. Please follow up with your cardiologist immediately, because that blockage might be severe enough that it's creating symptoms, just not severe enough that it's actually damaging the heart muscle, okay? That's when it's going to become a true heart attack. Exercise stress test, treadmill test, exercise tolerance test, it's all the same thing. They're working you out on a treadmill with a heart monitor on to see how your heart is handling the extra demand, okay? How can your heart handle that exertion? Is it able to get more blood flow to your muscles? Is it functioning properly? They're going to look at all different types of things with your heart and how it's responding to that extra demand. If you're not able to walk on a treadmill, they do have a medication they can give you IV. This medication will give you a really warm, flushed feeling, but it makes your heart think it's working out. You'll feel like your heart's just racing. So that kind of tricks your heart into thinking that you're exercising. Heart catheterization, they're going to take the little catheter with the camera on the end, and they're going to feed that through your arteries all the way into your coronary arteries on your heart muscle. And they're going to look and see where the blockage is. They're going to see how much blockage. Now, what percentage? Do you have just 60% blockage, or do you have 100% blockage? How many blockages? Is there more than one? So the heart catheterization gives them a lot of good information, but it is invasive, so they will save that for last. They're going to look at these other tests first, and if those tests are positive, then they'll move on to the heart catheterization. And that's just going in through your groin or through your wrist into the arteries, into your coronary. Now, recovering after an MI or heart attack, the first week you return home, you may feel tired or weak, okay? Whether you had stents placed or you just had angioplasty or you had open heart surgery, you're going to be tired and weak, okay? It takes time to heal. It's definitely going to take longer to heal from open heart surgery because you're going to have healing in your sternum bone. When they cut your sternum bone open, that takes 12 weeks to heal. And you have a lot of restrictions. You have sternal precautions where you're not to lift heavy objects, nothing more than 8 to 10 pounds. And, a gallon of milk is 8 pounds. So you have a lot of restrictions not to raise your arms above your shoulder level. All of those things you have to keep in mind. You can't reach up into a cupboard or brushing your hair, things like that. So you're really dependent on family and friends assisting you. But either way, you are going to be tired and weak. So no lifting heavy objects, even with place stentment, okay? They want that stentment to become nice and lodged in there into that plaque area and held nice and tight. So that they'll tell you not to lift anything for a few days. Pace yourself, all right? You don't want to go home and just sit on the couch and do nothing. That's not good for your body either. Walking is the best thing you can do, all right? You want to get up and move. Walking to help regain that strength. So you're going to regain strength by pushing yourself a little bit, but not too much. Remember, we got to gradually work back into this, okay? You're not going to be able to jump back into where you left off. You need to start small. You need to go for short, small walks and then rest, and then get up and do another short, small walk and then rest again. So you want to balance those activities. You want to increase that walking a little bit each day so that you're going a little further or doing a little more to help regain that strength, to help get stronger. Try to resume your hobbies, your social activities. It's important that you don't isolate yourself, okay? This is a life-changing event. It's very shocking to a lot of people. You're going through a lot of emotions. And it is very common for people to become tearful after a heart attack or heart surgery. It's common to go through some depression. So it's good to stay active, and it's good to continue your hobbies and social activities, okay? Just a little bit at a time. Gradually work back into it. But don't isolate yourself, because that will only make it worse. You need to talk to people, talk about your emotions, talk about your feelings. And if they get really severe, you need to let your doctor know. It's common for all of us to get down, a day or two here and there. But if you're feeling really down for weeks on end, then it's something that you need to let your doctor know about. He can help you. Also, you're going to want to notify your doctor if you're having any concerns with symptoms. If you have the chest pain or shortness of breath, dizziness, irregular heartbeats, feeling like your heart's racing, those are things you need to let your doctor know about as well. All right, so that's it for heart attack or myocardial infarction. Now we're going to talk about heart failure. So heart failure is a condition in which the heart's function as a pump is inadequate. It's not able to deliver oxygen-rich blood to the body as a normal, healthy heart should. When this happens, then your blood flow is slowed down. That's going to cause fluid to build up in your interstitial tissues, okay? It's not, your circulation is slowed, it's not as being pumped as strongly because your heart is weak. So that circulation is affected. Your heart's not pumping strong, circulation slows down, and fluid tends to build up. Now, congestive heart failure is not something that can be cured unless it is due to a leaky valve, but we can control the symptoms and we can slow down the progress. Okay, it is a progressive disease that we can slow down controlling symptoms and helping your heart function at its optimal level. Know your instrument. The normal amount of blood pumped out of your heart with each heartbeat is 55 to 65%. Okay? 55 to 65%, that is known as your ejection fraction. Every time your heart squeezes or contracts, it's pushing blood out the aorta to your body. Every time, it should be pushing out 55 to 65% of the blood that's in the heart muscle. It doesn't completely empty, okay? But if you have 55 to 65% being pushed out to the aorta, to your body, you have a nice, healthy heart. All right, so this is a good way, the ejection fraction is a good way to see how strong your heart is. All right. Now, the ejection fraction has to be determined from an echocardiogram. That is just where they're using the ultrasound to look at your heart. They're measuring lots of different pressures in your heart chambers and your arteries. They're looking at your valves. Are they opening and closing properly? And they're measuring how much blood is being pushed out. So a lot of good information comes from echocardiograms, and ejection fraction is a really good one. So you want to impress your doctor the next time you have a visit. Ask them what your ejection fraction is. That's going to give you an idea if your heart's working optimally or not. So there are two types of heart failure. There is systolic failure. Systolic failure is when you have a weak heart muscle, okay? This will affect your ejection fraction because the heart muscle being weak, it's gotten stretched out. The cells, the myocardial cells have been stretched, the wall has been stretched out, and instead of it pumping efficiently, it's now weakened from being stretched out and thin. So it's not able to squeeze nearly as strong. So you're going to have less blood pushed out to the body. So your ejection fraction will be less than 40%. Right? That is systolic failure. Now, diastolic failure is when your heart muscle walls are thick and stiff. Okay? So you can see here in this diagram how it shows your ventricle wall. Now, your left ventricle wall is always a little bit larger than your right and atriums, but you can see here, this is a really thick wall. And when this becomes so thick, it gets stiff and hard. And the problem with that is now it's not able to relax. It's not able to open up to let the blood fill, okay? So you'll have blood coming in, and you might have 55–65% of that blood being pushed out to your body. The problem is your heart's not filling completely. So even though it's pushing out 55–65%, it's not getting in the amount that it should. Okay, so it's really giving a decreased amount to the rest of your body. So you're looking at a problem of the heart filling. It's not able to open up, relax, to fill completely like it should. That is due to thick heart walls. So your ejection fraction with this might be normal, but you still can have heart failure. So what causes heart failure? High blood pressure. And we're talking long-standing, okay? If it's untreated. Blood pressure is a silent killer because people don't realize they have high blood pressure. And if it goes for a long period of time and it's not treated, then it causes damage not only to your coronary arteries, but to your heart muscle. Because your heart muscle has a large amount of pressure being pushed against it constantly for a long period of time, it causes damage. That's where it can either get thickened and stiff and not be able to relax, or it can get stretched out and have thin, weak walls. So high blood pressure can cause heart failure, as well as a heart attack or a myocardial infarction. We talked about how the heart muscle starts to die when it's not getting the blood flow it needs, below a blocked artery. Once that heart muscle is gone, it's permanent. So now you only have, the remaining part of your heart functioning. So that can put you in heart failure because your whole entire heart is not pumping. Valve disease. So your valves sit between your heart chambers. You have the 4 heart chambers, your atriums and your right and left atrium, right and left ventricle. And in between those, you have valves that open and close. Those heart valves are keeping the blood moving forward to the next chamber. If that valve is not closing completely, you might have a little leakage. You might have a little backflow. If you're getting backflow of blood, you're not getting as much pushed out to your body. So if your valve's not functioning properly, that can cause heart failure as well. Symptoms of heart failure. You're going to be tired because your circulation's affected. You're not getting as good circulation. You're not getting as much oxygen to your muscles. And that circulation being slowed down is going to cause fluid to build up. Most of the time you'll see swelling from that fluid buildup in your feet and ankles, your legs. That's just kind of gravity. That's the general area where you're going to see it usually. But there are some people that only carry it in their abdomen. Their swelling will just occur in their abdomen. They'll notice their waistline or their pants are getting tight. So that's another type of swelling that you can have. You're going to have weight gain as well from the fluid buildup. We're not talking fat, we're talking fluid that's going to increase your weight. Shortness of breath, because you're not getting as good circulation. You're not getting as much oxygen, especially when you exert yourself. You need more oxygen to your muscles. Your body muscles need more oxygen to function when you're exerting yourself. So you're going to become short of breath very easily, and you're going to have difficulty sleeping flat in a bed if you have a lot of fluid buildup, right? You might be able to get relief from the shortness of breath if you sit up, leaning over. Sometimes that helps relieve that shortness of breath. But when you lay down, you have a lot of fluid into those lungs. And the lungs are just like sponges, and that really affects your breathing. You might have difficulty sleeping laying in a bed. You might have to sit up in a chair. Diagnosing heart failure. Based on physical examination, doctor's going to listen to your heart, going to see if the valves, sometimes you can hear a murmur if the valve's not opening or closing correctly. They're going to look at your history. Have you had a heart attack in the past? Have you had heart damage? Have you had high blood pressure for a long period of time that wasn't treated? They're going to do an echocardiogram. They're going to measure all the different pressures in your chambers and how much blood's getting pushed out to your body, how much blood's flowing into your heart. They're going to look at your ejection fraction. They're also going to look at blood tests. They can draw blood to look and see how much fluid you are retaining, if you've got fluid buildup from those slowed circulation. And they can do a cardiac catheterization, where they're going in with the catheter through your arteries and looking at your heart. So treating congestive heart failure, our goal is we want to ease the workload of the heart, okay? We do not want your heart to work so hard, because if it's continuing to struggle and continuing to work really hard, that heart failure is just going to get worse and worse. So we need to slow that down, decrease that workload so that your heart muscle stays the strongest that it can, so you don't have more damage. We want to improve that heart's function. Now, we also want to keep those symptoms under control. We don't want you to be so short of breath that you can't function and do things, and we don't want you, having a lot of swelling. So we're going to do that a couple different ways. Medications, diuretics, are going to help get that fluid off. Those are those medications that keep you running to the bathroom. Furosemide or Lasix, those are the most common, but there are others out there. Those medications are so important. And I know a lot of people hate to take them because they have to keep running to the bathroom, but they are very important to take, all right? You need to stay on schedule. If you have a diuretic ordered twice a day, I always recommend taking that second dose late afternoon instead of right before bedtime. Otherwise, you're up all night long going to the bathroom. So if you can take it late afternoon, you can get some of that fluid off before you go to bed. They'll also give you what they call beta blockers, and this medication is going to help decrease the workload, as well as medications that help decrease your blood pressure, okay? So these medications are helping your heart work at its optimal level. Also, lifestyle changes. A low sodium diet, 1,500 milligrams or less a day. You can get so much sodium just in food that's packaged. Just if you start reading labels and see how much sodium is in the food, you'll get enough throughout the day without even adding salt or cooking with salt. So be very cautious of this. If you have heart failure, this is really important for you, because that sodium is going to hold on to fluid. So you're going to retain even more fluid and you're going to have more symptoms. Also exercise. Heart failure is really, it's a vicious cycle because you get short of breath, so you do less. But when you do less, your skeletal muscles get weaker. When your skeletal muscles get weaker, they need more oxygen to function. So when you do get up and go to the bathroom, now it's going to need more blood flow and more oxygen than if you had healthy muscles. That makes sense? So if you're getting short of breath and you do less and less and you get weaker and weaker, it's this vicious cycle and it's going to get worse and worse and worse. You can push yourself a little bit and balance rest and activity. That's why this exercise is so important. Okay, we're trying to help you get stronger. Your heart's a muscle. We're getting that heart muscle stronger as well as skeletal muscle. Okay, and this is going to help you to have a better endurance, have a better lifestyle so that you can go and do the things that you enjoy doing and not be stuck at home sitting in a chair. Now, surgery would only be done if it is a valve because they can go in and repair or replace the valves that are not functioning properly. So what you can do, this is important. You want to weigh yourself every day. You're looking for fluid buildup. Make it a habit. Every morning you get up, go to the bathroom, get on your scale. Just make that an every morning habit. Keep a logbook of your weight, whether you're putting it in your smartphone or you're keeping a notebook next to your scale. Whatever you're doing, monitor that weight daily. Take your medications as prescribed. Don't try to put off taking a diuretic because you need to run to the store, okay? This is very important. You don't want to skip these medications. You want to decrease the workload of the heart. Eat a low sodium diet. We already discussed this. 1,500 milligrams a day is your limit. Some doctors even say 1,000 milligrams a day, depending on how severe your heart failure is. You want to report any kind of signs or symptoms to your doctor if they're getting worse. That's very important. Avoid tobacco, okay? You want to avoid that tobacco. Remember, it's going to cause your blood pressure and your pulse and your heart to work harder, so that's important. Any tobacco product, not just smoking. We're talking tobacco products like chewing and vaping, all those things. Balance activity and rest periods. Just like we discussed, you don't want to sit around and do nothing because it's hard to do stuff when you get short of breath. You need to push yourself a little bit. You need to break that vicious cycle so that you can stay strong and you can do more. Heart failure has 3 different zones. We have the green zone, and this is the good zone. This is where we want. See the little happy heart. No shortness of breath, no weight gain, no swelling in your feet, ankles, legs, or abdomen, and no chest pain. We have all your symptoms under control. Your medications are balanced just perfect. You're in good hands, okay? This is great. This is where we want you to be. Now, the yellow zone is the caution zone. This is when you need to intervene and you need to call your doctor. Very important. If you have a weight gain of 2 pounds in a 24-hour period or 5 pounds in a week, that is fluid buildup, not fat. You're going to want to let your doctor know. You're starting to retain some fluid. Something needs to be adjusted here. You're going to have increased shortness of breath, swelling, feet, ankles, legs, or abdomen, wherever you're carrying that fluid, feeling more tired or having no energy due to this fluid buildup. You can have a dry, hacky cough and it starts to get into your lungs. Dizziness, or just feeling uneasy, like something's not right, I just don't feel right. These are all signs of worsening of heart failure. And a simple phone call to your doctor can prevent an ER visit, okay? Maybe you just need to call your doctor and he needs to say, let's increase this medication, or let's take an extra dose of diuretic, or let's increase your diuretic. Discuss this with your doctor because he can probably adjust medications over the phone to save you from going into the ER. Because if you don't call your doctor and intervene when you're at this point in this yellow zone, this caution zone, then you're going to end up in the red zone, and you don't want to be here. This is very common for heart failure patients to end up in the ER over and over and over again because they don't contact their doctor. And I know it's hard to get through to your doctor, but be proactive, all right? Call, you're going to have to leave a message with the nurse, then they're going to call you back probably late afternoon. And if they don't call you back late afternoon, keep calling every day. Just keep calling and bugging them over and over and over until they get back to you. Once you're in the red zone, now you're struggling to breathe no matter what. Even just resting, you're still short of breath. Now you're gonna, you have the swelling, your feet, ankles, legs, or abdomen, wherever you have it, you're swollen. You can even get so severe that you have chest pain or confusion. So this is really getting bad. And this can come on suddenly. So intervene when you see your symptoms coming on. Catch that before you end up in the ER. Nobody wants to go in the ER and get stuck with IVs and sit there for hours on end. Much rather have a phone call to your doctor and prevent all this. Okay, so that's our lecture on heart attacks and congestive heart failure. And if you have any questions or concerns, please come see me in cardiac rehab. Thank you.